Well, it's just over a year since the first COVID-19 case was recorded in South Africa. Over the past 12 months, the virus has evolved and the country has had to deal with different strains as well as the effects brought by the pandemic. Let's discuss some of the lessons that the country has learned over this past year. Joining me now is Clinical Virologist at Lancet Laboratories, Professor Eftyhia Vardas. Good evening, Professor, and thank you so much for your time. I suppose the one big issue is around approach. You know, it was very clear at the onset of the lockdown that there was a lot that was not yet known, and therefore there were different approaches being taken in terms of how best to curb the spread of COVID-19. A year later, how has knowledge, how has science informed the different approaches?
Well, it's been an incredible journey. I think we have squashed in 10 years of knowledge in 1 year. And this has never happened before. We've been able to move quickly. And I guess that's where a lot of the confusion and fear came along as well, because we were learning every single day. So we learned a lot about the virus very quickly. We learned about how to diagnose it very quickly. We learned how to make tests quickly. I mean, in South Africa, it's an amazing statistic that we've done 9 million COVID tests. And so that's an amazing growth of science and medicine. People learned very quickly how to clinically deal with patients with COVID as well. But it was a very steep learning curve, and we had to squash all of this knowledge into a very short space of time and had to move very quickly. So I think we did a magnificent job with that. But we are still all affected, and we all have every single day something that has happened because of COVID. And I think it is not only a virological problem, but also an economic problem and also a political problem.
So for laboratories like Lancet, at the onset of the virus, there was a time where many laboratories had come under severe strain and facing serious backlogs when it came to testing. What are the lessons that you have learned from that, and how are you using it as we go through the different waves of the virus in the country?
It was very clear at the beginning that we needed more tests, and we started off with a capacity of at Lancet Laboratories alone of about 1,000 tests. That was in March, towards the end of March, and that had to ramp up very quickly to about 15,000 tests. I mean, you can imagine that this is logistically a difficult thing, especially when you're competing for resources globally for the test reagents, etc. So it was really a lesson learned, but there was a lot of cooperative work together with all the other private laboratories as well as the public sector, and I think we did a magnificent job to ramp up. But it was really hard. Probably the worst year of a clinical virologist's life, because at various stages, and I'm sure you know about this, is we had to keep on restricting the testing to the people that needed it, that had symptoms or were admitted, because we just didn't have enough reagents. Regarding the backlog, I think we all went through periods where we had backlogs, and we had to, a 4-day backlog, that test is no longer useful for that individual, and so we all had to face those issues. But they were short and brief, and we overcome that both in private and in the public sector. So I think it's an amazing testament to the scientific and medical capabilities of South Africans.
Professor Vardas, the one thing that I've noted in government communication in particular, and the communication around this virus, is that there doesn't seem to be such a great emphasis on testing right now as there was before. Talk to me about what some of the reasons for that could be, and what the implications of that are in the longer run, especially as we're now also facing the risk of a third wave, whenever it might be, but just the possibility that it might take place means that we certainly don't have room to let our guard down.
Well, basically, the reason why it's not being spoken about is that we have capacity. So the country is really well placed to do testing if it's required. And certainly, and let's hope that the third wave, when it arrives, is not going to be as enormous as our second wave was. But no matter what, we still have the capacity. And so that's not the level of stress at the moment. The level of stress, as you know, are the variants and the vaccines. And that's what we need, further and more communications to try and clarify the situation where we are with the variants and the vaccines. We mustn't over-exaggerate the variants. We can't ignore them. But also we need to not overthrow our vaccine rollout as has happened already.
Has our testing regimens, this is across the multiple provinces, has that been on par with the kind of the rate of infections that we have seen, and how the numbers of those that have been detected from within laboratories versus the community infections?
I think that the community sort of based testing, that really hasn't evolved. There has been some antibody testing done in communities and some antigen testing done in communities. But initially, when we started off doing PCR testing in communities, we realized that that was firstly very expensive testing and difficult to maintain that sort of level. And also, we just didn't have enough for the clinically ill patients. So the community-based testing has grown now, but with other testing methodologies to find out if you've had COVID in the past, using antibody testing and antigen tests, which during our second wave, community-based testing with antigen tests is a very good way of doing that. Within the hospitals and in clinical situations with people that are ill, the PCR testing capacity is really at a really good position, and we can roll out testing and do it every single day. You know, we say that we're not in the peak at the moment, but we, in our own laboratory, are doing about 5,000 samples a day still. So, you know, there is a demand for testing. People are using it for travel, which is important as well. So there is still a demand for testing, but we can cope. There's no issue at all.
Professor Eftyhia Vardas is a clinical virologist at Lancet Laboratories. Thank you so much for joining me tonight for this conversation. And happy International Women's Day, Prof.